The schools have begun their new term. So far, nothing seems amiss. The real issue, however, is that if we were to visit hospitals and identify the current incidence of hepatitis A cases, at the very least, we would be quite concerned, and that's why we'll go directly with this pressing problem to Dr. Ovidiu Peneș, a distinguished doctor in medical sciences, whom we will ask what on earth is truly happening with this
and
hepatitis.
Also with hepatitis
yes.
in general, because in addition to these hepatitis viruses that Teo mentioned just a moment ago, and many others, because beyond type A, you will find there are still more, but generally impacting children and adults who don't consistently adhere to proper hand hygiene practices. Generally, they are susceptible to this hepatitis. It's a virus that you ingest and then it impacts your liver. But there are also many other viruses, and perhaps you've heard news lately about an entire range of unknown viruses. Some said it was COVID, others said it was that, and they started affecting the child. Adenoviruses, other types of viruses, even herpetic ones, and all sorts of these viruses that have a higher or lower incidence end up in one form or another to affect the liver as well. But why exactly is our liver so important? It's an organ our very lives depend on because it performs multiple vital roles. It's such a critically important organ for our entire metabolism. Everything that we consume, all the food absorbed at the intestinal level must be processed by the liver so it can reach a usable form for our cells. So any cell that needs nourishment depends directly on the liver's function. On the other hand, the liver also identifies all the toxins produced within the body or those coming from outside. And now both children and adults are exposed to extremely polluted sources. Sources with toxins, all sorts of packaging, all sorts of meat containing heavy metals, meat that is sprayed with various substances injected with antibiotics. All of these must be processed by our poor liver. Besides this, you might also get the flu, a cold, or pneumonia. You might also need to treat yourself with an antibiotic. All of this is processed by your liver. So think about it. Your liver is extremely important for this. Another role it has, you see, it has a small sac there, what we call the gallbladder. It also produces a substance that helps with digestion. That is, it empties into the intestine and breaks down food along with gastric juice and other pancreatic juices. So it also plays a role in digestion. But its essential role is here, in metabolism, and of course it metabolizes hormones. All our body's functions depend on the liver working well. So when it has a problem like this hepatitis, let's see what happens when we get hepatitis. We ingest, for example, in the cause of hepatitis A, the so-called dirty hands disease, or contaminated food. Sometimes you go to a canteen somewhere, or to a restaurant, or you eat food that you've ordered. And these young children are truly very exposed to this situation. These viruses can simply be found on eating utensils or even directly in their food. You swallow them and they reach the liver, causing various types of hepatitis, such as hepatitis B, C, and so on. You'll also see adolescents starting to get piercings or tattoos. You need to pay very close attention to where you go, ensuring it's for single use. And I'm not even going to talk about used needles, though nowadays in the medical system everything is used only once, but there are still things that are inserted under the skin and performed in all sorts of these types of salons. Be very careful that they are properly sterilized. Unprotected sexual acts and so on transmit other types of viruses, such as hepatitis B and C and so forth. Ultimately, regardless of the path through which this virus enters the human body, it makes its way through the bloodstream to the liver itself. And then it enters the liver cell and infects it. That is, it enters the genetic code, much like a computer virus would infiltrate a computer software. So the virus unpacks and enters the genetic code of the liver cell, and that begins to inflame. An immune response starts. The antibodies try to kill the virus, but since the virus is inside the liver within the cell, the antibodies then begin to simply attack the liver cell itself. And then if it attacks the liver cells, an inflammatory process will begin. The liver starts to swell, and you might experience a slight tension, pain, and fever. So a whole series of symptoms will begin. And I urge you to pay close attention to your child or to yourselves if you start to experience these symptoms. A slight tension starts with intestinal discomfort because digestion, which we know plays a role, is no longer as good. The stool, because that bile is no longer eliminated to darken it, can start to be light in color. Now, instead, all that bile all that bilirubin. It also plays a crucial role in breaking down and metabolizing the dead blood cells, specifically the red blood cells. And from their breakdown product, this yellow substance, bile, is formed. But instead of expelling it, instead of converting it into bile salts to be used for digestion, it gets released into the bloodstream. So it remains in the blood, and once in the blood, it begins to color the body's tissues. And little by little, at first very subtly, you'll notice the white part of the eyes around the pupils starts to turn slightly yellow, but then the skin also begins to change. And besides this abdominal tension, the abdomen starts to swell because blood vessels pass through it, which due to inflammation easily get blocked and then accumulate water fluid. The belly is so much more voluminous. Just look, it's distinguished by its sheer volume, that amphibian-like belly, you know, like a frog's, right? Right. Certainly headaches, the accumulation of toxins, impaired bodily functions, ammonia, and numerous other toxic compounds produced internally by the body and entering from the outside, which are no longer being properly processed by the liver. They ultimately start to affect your brain, and you begin to experience dizziness, to find it difficult to concentrate, to feel constantly and extremely tired. These represent some of the initial warning signs: tiredness, extreme tiredness, persistent tiredness.
You don't know why you're very tired.
You experience nausea, you experience vomiting. You gradually begin to turn yellow in the following days, and you develop a fever. This is especially true for these type A hepatitis infections. Pay very close attention. The other types B, C, D, and E do not always present very clearly and frankly. They are insidious, incubating for a very long time. Some can even take up to 180 or more days of incubation, meaning from the moment of infection until the illness actually manifests. And sometimes you find them in blood tests because you're just tired and don't really have other symptoms. He also said you only start having symptoms when the disease is very advanced. PH madness, but with hepatitis, fever, and a general bad feeling. But what can be done, Dakar? You must immediately notify your family doctor, I said, the attending physician. You also need to be seen by an infectious disease specialist, because it is crucial how you manage this illness right from the beginning. You saw that, unfortunately, those children ended up with this unknown virus, and it's still unclear what some of them ended up with, even requiring liver transplants. Why? Because the liver's destruction is so massive following this infection, and this can happen, for example, with hepatitis B, a very significant destruction of the liver, that the cells separate and are released into circulation, and you see in blood tests the so-called transaminase is very elevated. Instead of being a few 30, 50 or so, they start reaching 10,000, 20,000, so it's seen as fulminant. Other infectious hepatitis types are less severe. So you go to the doctor to get blood tests, be examined, have a liver ultrasound, possibly an MRI, and then start treatment, right? Because this particular disease cannot be treated at home, but fortunately it is treatable.
It's treated.
And as I was saying, there are also many other viruses. The most important thing is prevention in the case of this hepatitis, because if you know how you can contract them, it is essential to protect yourself.
There's not much you can do to avoid an inattentive dentist.
Very rarely during this time, in recent years, you know, before the communist era, syringes and needles were boiled at 100 degrees. You know, hepatitis B doesn't die, it requires more. So this virus is it's one of the most resistant viruses. So just boiling wasn't enough for medical instruments. And unfortunately, at that time, there weren't really any widespread sterilization methods available. It needs over 120 degrees and a specific atmospheric pressure to destroy its protective capsule. But now, most of them are used. I mean, everyone uses single-use items. So if you've used a disposable syringe, if you went to a tattoo parlor and made sure, or acupuncture, you know, people still go for acupuncture, traditional Chinese medicine, and other such things, and those needles. Generally, I've seen everyone uses it as single-use, but you should check. You'll always see this. When you go to a serious collection center, they'll show you the instrument label. Yes, and with that date, it expires. Look, it's sterile. I have actually opened this up for you and all that kind of thing. What is truly very important, especially when we're talking about children, you must teach your children to be very careful so they don't get infected with hepatitis A. I mean, preventing this is actually quite simple. Immediately, it is the so-called fecal-oral route. So in one form or another, within the entire cycle of that particular food product, it was touched by hand that had come into contact with fecal matter at some point in time. So, Hand washing is absolutely vital. Teach your children to only eat from authorized sources. This means it's good we don't share our snacks. Let's not exchange sandwiches that Giorgio's mother prepared at home, and we don't know if she washed her hands when she made them. It's much better for each person to have their very own little snack pack and a clean handkerchief. We must wash our hands thoroughly every single time before we eat. We only eat prepackaged food and avoid touching surfaces and other objects. We should also carry disinfectant because these cases of hepatitis A, as I mentioned, although treatable, ultimately you'll find a very serious intervention is rarely needed.
I'll get away.
Yes, it's supportive care, no strenuous activity. It gives you an exemption from school and from sports for a while because you're not allowed to exert yourself to recover. But generally, this particular type of hepatitis passes without any lasting consequences. However, other forms of hepatitis are considerably more serious and can lead to very advanced stages, potentially putting a person's life in grave danger. And naturally, as we've discussed, you could then require a full liver transplant.
Among these various types of hepatitis, which is the rarest and the one we know the least about?
For example, types D and E. Generally, these are the common ones. You will never get infected solely by this particular virus. When there are certain areas like these, you travel to certain countries. When you start traveling abroad, taking certain types of vacations, and you find yourself in or visit these very disadvantaged regions where conditions coexist. So these are co-infections. You never get infected only with this rarer virus. You get infected with B and with the other one.
God help us, we'll also get our vaccinations done beforehand, exactly as stipulated.
Regarding certain things, you should know they are made right from birth, as for B.
We thank very much Dr. Ovidiu Peneș, a doctor of medical sciences. At least we've clarified what hepatitis A is. We must be careful to wash our hands, just like Bella does every time before she starts cooking.